Tonight, hospital waiting rooms across central Arkansas are full, and doctors expect them to stay that way for a while. Thanks for watching. I'm Faith Wooder.
And I'm Rolly Hoyt. Doctors say a lot of those cases are flu related, and the state sees what the Department of Health calls very high activity. But that's just a piece of the problem. As
THV 11, Sarah Horbakowitz spoke to an ER doctor to find out what's causing the long wait times.
Yeah, Faith, no one wants to wait in the emergency room, but with so many sick people, UAMS says it could take up to 6 hours for less critical patients to get a room. And an ER doctor I spoke to says they're even sending physicians to work directly in the waiting room to assess patients or see them in the hallway to try and catch up. Dr. Wes Watkins has worked in the UAMS emergency room for the last 8 years. So is this the busiest you've ever seen it?
Yeah, I mean, since I've been here, this is the busiest we've been.
Some of the demand coming from a late season spike in flu cases that Watkins expects will continue climbing.
It doesn't feel like flu season, but you look at the data and we're right in the heart of our worst part of the season.
Watkins believes typically the flu patients he sees in the ER aren't vaccinated, advising it's not too late to get your shot.
The number one thing you can do to protect yourself is be vaccinated against all these respiratory viruses, especially if you have underlying lung disease, underlying heart disease.
But it's not just the flu. Watkins says they're seeing more patients overall.
We've had higher acuity patients, both in the hospital and in the ED. Not only are we seeing more patients, but they're sicker.
As doctors try to accommodate full waiting rooms.
We've been trying to be flexible and creative with how we care for patients because we want to take care of this community, right? It frustrates us to have them sitting in the waiting room for 6 hours.
But Watkins has a message for the public. If you're having an emergency, you won't be ignored.
If you're suffering from an emergency or you think you're suffering from an emergency, this is the place to come. And we're going to make an evaluation and determine whether you have an emergent condition and treat you appropriately.
Now, there is some better news. Watkins says while they are still seeing some COVID cases, it appears to not only have slowed down, but current strains seem less dangerous.